Hello everyone. Welcome to the second episode of Let's Talk Health by Star Hospitals. I am Dr. Madhuri, Senior Consultant Rheumatologist at Star Hospitals, who will be hosting the show for today. Today I am happy to have with me Dr. Sindura, our Senior Consultant Dermatologist at Star Hospitals. And Dr. Sindura and I are today going to discuss about a very common skin condition which is also very troublesome, psoriasis. Let's start off by asking Dr. Sindura, what or when should we suspect psoriasis?
So psoriasis is this inflammatory condition which we see on the skin. So most people feel that any itchy condition on the skin could be psoriasis. So when a patient comes to me and they have like some itching on the legs or an itching on the scalp, they just feel like ma'am, is this psoriasis? That's what many people think. But psoriasis presents mostly as less itchy. If it's too itchy, it is less likely to be psoriasis. So sometimes it might be itchy, it may not be itchy, but the classical sign is that it may be on the scalp, on the elbows or on your knees. You will get reddish patches which have these typical white, thick, silvery scales, and when you scratch, the scales fall off and it might occasionally lead to bleeding as well, very tiny pinpoint bleeding. So these are the classical signs of psoriasis, but some people can get it all over the body. Some people may develop it gradually. Age-wise, we can see it in children, but very uncommon in infants. But almost from the age of 4 to 5, psoriasis can start off. It can start off in middle age or it can start off in elderly also. But the typical age pattern is bimodal, where we see mostly during the 20s and then during the 40s again. And So at the time that you have to suspect psoriasis is, especially in adolescents, these days what I'm seeing is a patient has a lot of itchy skin on the scalp, a lot of flakes. Most parents think it's just dandruff. They just come and say no matter whatever shampoos we are using, the dandruff is not going away. And then once we see these reddish patches on the scalp with a lot of thick white flakes. So when you have these thick white flakes, immediately take him or her to the dermatologist, because you have to know whether it's psoriasis or it's simple dandruff. And coming to the other forms of psoriasis, these days, especially in children and in like young people, post a viral infection, we see these small patches all over the skin. So these patches are known as gutted psoriasis, and they occur as an eruption. So in normal psoriasis, it forms off like a very gradual patches which can occur only on the scalp or some parts of the body. But sometimes when you have a sudden eruption of these reddish things all over the body also, then we might have to suspect gutted psoriasis, which can be little itchy as well.
So that's a very important point, that it may not be only dandruff, it may be psoriasis also. Dr. Sindura, what other itchy conditions should we consider or would you consider when you see a patient who complains of this itchy skin?
So when we think of itchy skin conditions, the most common other condition that comes is eczema. So the eczema versus psoriasis has always been sort of a diagnostic dilemma, especially when it occurs on your palms and soles. Because most of the times people go to one dermatologist, they say that it is eczema, and then they come to another and they say it is psoriasis. So the most common pointers towards psoriasis are, itching in psoriasis is always lesser than itching in eczema. And eczema can also be a little oozy. So when you scratch, you have these little wetness that can come onto the hand. Whereas psoriasis will have more of cuts and more of bleeding. And eczema happens mostly on the fingers and the fingertips and all, where you touch your detergents, where you touch certain vegetables like onion and all, which can cause the eczema. Whereas psoriasis occurs mostly on the palmar surface, which is like a thick, dry patch and which can cut. So when there is more itching, more oozing, we think of eczema, whereas when it is more dry and cuts are there, we think of psoriasis.
So psoriasis or eczema would be a clinical dilemma. Now, would either of these conditions be only cosmetic problems, or would they involve or even lead us to consider more systemic or more serious illnesses? What is your opinion?
So psoriasis has always been considered as a cosmetic problem, like it's just a patch on the skin and when you apply moisturizer or something it settles down and all. But of late the research shows that, and also we also come to believe that it's more systemic in nature. So when you're, especially as an adolescent, when you're developing a sort of a thick flakes on the scalp and come to the diagnosis of psoriasis, that is much more deeper than the skin. So we have to think about metabolic syndrome. So metabolic syndrome is pretty common in these days, even in adults, adolescents, even in children as well. because of our current lifestyle practices, our unhealthy diet, excessive sugar intake, excessive junk food intake, plus of course our sedentary lifestyle where there is absolutely no activity. So because of this, metabolic syndrome comprises of obesity, high blood pressure, high cholesterol levels, high sugar levels, may or may not have all these components, but even one or two of these components can lead to inflammation in the skin, which in turn leads to psoriasis manifestations. So when a person is having extensive psoriasis on the body, it also means that there is inflammation inside the body also. So it can affect your blood vessels, and over a long period of time, if this is uncontrolled, it can even lead to plaque formation in the vessels and lead to almost cardiovascular, which is, it can affect your heart, it can affect your brain, but it's not a very common side effect. All I'm trying to say is, when you're having these lesions extensively, we have to look at your lifestyle. Make sure you're following a healthy lifestyle, thus reducing the inflammation along with managing your psoriasis. So one more important thing we have to note in psoriasis is the presence of arthritis. So these days, most of the people do Google psoriasis, and of course then comes up psoriatic arthritis and all the deformities that come with it. And the initial question they ask is, will my joints be involved, or how bad is it going to be? So around 30% of people with psoriasis can end up with arthritis. And coming to other signs of psoriasis which point towards people who might develop arthritis are nail changes. So a person with psoriasis who also has extensive nail psoriasis or nail changes in terms of small pits on your nails or thickening of the nails or having reddish patches on the nails, that also is a pointer that one might develop or one already has a joint involvement. So I request Dr. Madhuri to please enlighten us on how to differentiate psoriatic arthritis from other forms of arthritis and how to manage it.
So as Dr. Sindura has mentioned, psoriatic arthritis can be seen in around 30% of people who have psoriasis. And the risk factors, like she has said, are those who are having nail changes. Even the presence of scalp psoriasis or extensive psoriasis can be a risk factor for developing psoriatic arthritis. Now, which joints are involved in psoriatic arthritis? It could be the spine, the neck, the lower back. It could be one of the large joints. It could be sometimes the smaller joints. Sometimes what we call the tendons, like the heel area or the sole of the foot, can also be involved. What we classically see in psoriatic arthritis is one side of the body is involved more than the other. Like you may have more involvement of the right side of the body as compared to the left, or vice versa. So this is called as a ray pattern, in which it is like a straight line distribution, as opposed to rheumatoid arthritis, which is the other common arthritis which see, in which you will find equal and symmetrical involvement of both the two sides of the body. So this is called a ray versus a row pattern. So these kind of signs regarding the distribution of the joints involved, the various patterns involved, the swelling and the presence of various other conditions like extent of psoriasis and the presence of nail changes help us to diagnose psoriatic arthritis. It is important to remember that even though the individual himself or herself may not be suffering from psoriasis, a first degree family member, that is an immediate family member having psoriasis, may also put you at risk for developing psoriatic arthritis. The management of psoriatic arthritis involves a lot of collaboration with our dermatologist colleagues, and I would ask Dr. Sindura to start off by explaining how she would manage a case of cutaneous or only skin and nail psoriasis.
So when it comes to management of psoriasis, what most people ask me is it curable? So when we are talking about a cure for psoriasis, I would say it is controllable, or I would say it is manageable. But when I can't say, okay, I'll give you this medication and you're out of it for the rest of your life. That is the most important point, where there is no cure for it. But when I say this, I'm also saying that certain triggers, when it gets triggered, say for example in guttate psoriasis, when a viral infection or a streptococcal infection has triggered the psoriasis might gradually improve once the inflammation inside your body settles down. In that case, we just give basic moisturizer all over the body along with a mild steroid ointment for the patches, and maybe an antibiotic if there is a tonsil involvement or a bacterial infection in the body. But coming to the classical psoriasis, in whom the body, the scalp, the joints and all are involved, the elbows and knees are involved. So in them, most important thing is hydration. So you have to keep on applying good amounts of moisturizer all over the body. And sometimes even after we treat it also, moisturizer helps in preventing a faster recurrence of psoriasis as well. So you should better consult a dermatologist to have a good option of a moisturizer. We most commonly use urea based moisturizers, which help in softening the scales of the psoriatic patch as well as help in reducing the thickness of the patch. So on top of the moisturizer, we usually give a salicylic acid plus a steroid based ointment, which helps in much better improvement in terms of itching also, symptoms as well as cuts and softening of the patch. So when people have like certain areas only involved, say less than 10% of the body surface area involved, maybe just the scalp and a few patches here and there, just moisturizer with ointments and a good lifestyle is sufficient. But when you have extensive disease on the body and which is not being controlled with basic measures, that's when we go for other medication. So by other medication, there are oral medications as well as injectables. But first, when we come to oral medications, most of the medications help in reducing the inflammation inside the body by reducing they're called immunosuppressants. So among that, methotrexate is the most common drug we use for psoriasis. And this drug, it is usually used weekly once and helps improve your plaque psoriasis by almost like 50 to 70% within a span of 4 to 8 weeks. But the dosage and everything is custom made and tailored to each person's extent. And once we start using it, you'll know how to titrate the dose and all of that. But there is one other drug which is more recent and which has helped with in milder cases of psoriasis called apremilast. The main point with apremilast is it has lesser side effects. So I tend to use it a little more because of longevity of its use plus relative safety of its usage.
So the use of these drugs like methotrexate and apremilast, we would like to just reiterate that these should be used under medical supervision only, and when used under proper doses and under proper guidance, they are very safe and very useful drugs. Apart from the role of drugs, however, comes the role of lifestyle. As we have discussed, a lot of our lifestyle contributes to psoriasis. So what lifestyle modifications do you think would be important for a patient of psoriasis?
These days, we have seen a drastic increase in psoriasis patients, the occurrence and frequency. It is because of our bad lifestyle manners or our sort of, downgrading lifestyle. So when I talk about lifestyle, it's about our stress levels, our diet, our sleep patterns, and our overall, environment. So coming to the diet part, most people ask me what to eat and what not to eat because they just, randomly think non-veg is bad for it, sour things are bad for it. So specific things which have proven to be bad for psoriasis are one, refined food. So when I say refined food, it's about your maida, your refined flour and your refined sugars. So all of these, they increase and spike up certain hormones like insulin and your sugar levels, and they lead to increased inflammation and psoriasis. So avoid sugars, avoid refined food, and other thing is avoid dairy products. When I say dairy products, excess consumption of milk, cheese and butter can also lead to this increase in this condition. And apart from this, when people ask me about seafood and non-veg, if you're consuming it in moderation and in a healthily cooked manner without too much oil, too much spices, and the consumption is not too frequent, red meat is not almost on a regular basis, then you're okay. Occasional intake in moderation in a healthily cooked manner is okay for psoriasis. So coming to sleep patterns now, because of either your work schedule or maybe just because you're watching too much of OTT, people are sleeping very late. So when you sleep at a later time, automatically your biological rhythm and your hormonal levels get changed in the early morning pattern, which increases your inflammation. So always make sure you're having a good 8-hour sleep and you're sleeping on time, at least by 10 p.m. And coming to the third thing, which is stress. So because stress is something which is a part of our regular routine, at least try to have some period of exercise, like whichever, helps you calm down, at least 30 to 45 minutes a day, which helps with improving your metabolism, thereby help reducing the inflammation. So with these changes also, there is a definite improvement in a person's psoriasis. Now I'd like Dr. Madhuri to please enlighten us on what kind of injectables are used for psoriasis and how they're going to help us.
So far Dr. Sindura has told us what are the lifestyle measures which are important, essential and mandatory for any patient having psoriasis or psoriatic arthritis, and some of the initial drugs which are used in the management of the skin or even sometimes joint psoriasis. However, there are some people who do not have adequate response to these level of management. So for these people, recently or over the last 10 to 20 years, we have these injections called as biologics. These biologics are more targeted form of therapy and they help both in the management of skin psoriasis and psoriatic arthritis. Depending on whether the person has only skin and nail involvement or also an associated joint involvement, either the dermatologist or the dermatologist and the rheumatologist can help in prescribing these drugs. These drugs are also very useful in controlling the disease, However, again, when you want to talk of a cure, I think the cure comes in changing the lifestyle. So with this, we would like to conclude today's episode of Let's Talk Health on psoriasis and psoriatic arthritis. We thank Dr. Sindura for being a part of today's show, and please keep watching this space for many more episodes to come.